Okay, everybody, welcome to ascp RxPerience, the podcast. I'm your host, Chad Wers, alongside my co-host, Tom Hansel, down in North Carolina. And today we have a very special guest. Some of you, I think maybe, have seen her in past activities with ASCP. Her name is Jennifer Hammer. She is with US Aging. She was a big part of our boxing vaccine program and some of our other vaccine programs during the COVID pandemic, and she's stuck around US Aging after that all sort of has settled down and now is doing dementia care. So welcome.
Thanks for having me. Glad to be back.
Yeah. So just tell us a little bit about, tell us a little bit about you, like how you got to US Aging and why that's a passion, and this sort of movement from the vaccine program to the dementia program and what you're doing today.
Okay, well, I think the shortest probably version, I was a Navy wife, so for 22 years, I moved around a lot, which led me into senior moving. So kind of helping people downsize, move to either assisted living or, smaller condos. That actually led me to some hoarding clean out. So more moving, more just memories about things and working more and more with the senior population. And then I had an opportunity to hop on board with US Aging once I learned about their mission. Just thought it was a great fit. And so they put me on a grant that introduced me to ASCP.
Yep,
so
there you
here
go.
I sit.
There you are. And right now you're leading Dementia Friendly.
I am the assistant director on Dementia Friendly America.
Nice.
So, which is we can get more into it, but it's a very non-clinical program, really for everybody to just kind of be introduced to dementia and to just increase awareness, reduce stigma, and just kind of understand what people need in their communities if they're living with dementia or they're caregivers, to just really live in their communities, engage, thrive, be a part of it.
That's interesting because I think in healthcare, we're going through, I wouldn't call it a movement. We're going through the age-friendly movement. In some ways, our members that are pharmacists and pharmacies have been doing age-friendly care the whole existence. I mean, ASCP is 56 years old. But I think healthcare is going through this, movement from this very clinical sort of way over here, high level, this is what you do to fix your problems, to this whole social component, which is what really matters to you and what's important about what you want out of healthcare. And it's kind of now coming toward that middle where there's this overlap of, individuals like you that have spent time on sort of that what matters side and have seen the real world consequences of diseases and conditions like hoarding. And then the clinical team who probably, whether you're a doctor or nurse, unless you're a home care nurse, have probably never seen anything like that before.
Right.
But now you're entering that space. So in our world, we recognize that older adults are becoming, there's more of them. And the percentage that they have a lot of comorbidities and are challenging or complex from a medical standpoint are in greater numbers, which is meaning few of them are going to nursing homes and most of them are staying at home.
Right.
So services are coming over to home and pharmacists are walking into what they may have thought was what their grandparents or parents' home looked like, but they might be finding things very different.
Yes.
And therefore very different challenges. So it's very interesting, I think, where healthcare is. And so I'm interested to hear more about the dementia friendly, especially from the perspective that you shared, because we're dealing with that, but we have no experience on that side. What's it look like at home?
Again, it's so non-clinical and it's really approachable. Anyone can become a dementia friend. So that's one of the pillars. We have 3 pillars in Dementia Friendly America. There's just becoming a dementia friend. So that's an individual thing that you can do by attending a session. You can take that and build across sectors. So banks, hair salons, grocery stores, restaurants, and become a dementia-friendly community. And that takes more of an effort and kind of a coalition, kind of like Age Friendly that you mentioned. We're very aligned with Age Friendly. And then we also, around the country, a lot of people don't realize it. So we're hoping to raise awareness. There are memory cafes. And again, non-clinical. These are places that you go to socialize and engage and meet people that are kind of sharing your lived experience. So those 3 kind of pillars are what we build on to just, and that's what Dementia Friendly America is. So again, just coming in to a home, whether you're a pharmacist, whether you're, maybe the cable guy, whatever. But this session can empower people to really just have some tools, some basic communication skills, some understanding of just how to not turn from this person, but turn towards them.
Wow.
So,
Great explanation.
yeah.
Well, Jennifer, I really love your background and kind of the really just being active with those seniors and helping them. I had that same experience with my mother when when my father passed away. She obviously wanted to stay at home. She wanted to live at home, and she didn't want to leave the house that she'd been in for so many years. And we really wanted to try to give her care as best as we could, but she wanted to keep her independence. And when she started getting sicker, she started realizing that maybe I can't be independent, but I don't want to obviously go to a nursing home. And so it really came down to her stuff. And she had a lot of stuff. She had been living in that place for about 40 years. And she just accumulated stuff. Now, she was really good at ordering on Amazon. And she knew Tiva really personally. And so she needed a flashlight. She wouldn't order a flashlight. She'd order a box of 12 because the caring children or their children might need a flashlight. And after doing that for 5 or 6 years, after my dad passed away, it just became just an amazing amount of stuff. But her biggest deterrent to getting healthcare help and living with us or with one of my sisters was her stuff, and just letting go of that. And I'm sure you've got some stories on how that
yeah, we could do another podcast.
On stuff.
On stuff, yeah.
I'd like to hear a few of those if you have them.
I have so many. I can tell you them now if you want, but
yeah,
it's very common. You hold on to this stuff for a lot of reasons. There's memories attached. But if you're maybe ordering a lot of stuff on Amazon, it's because you have such a generous heart and you think you're going to need more, or your family's going to need some. And so you order, lots of boxes from Amazon or, HSN or something, from a place of I want to share this with people. And that never really happens because a lot of people don't want this stuff. So we really did. And most people do want to stay at home. And so we would go in and just kind of help people declutter, talk about the memories attached to the stuff, help them donate it. A lot of times people don't want to throw it away. It's just too painful to know it's been thrown away. But if they think it's gone to help someone, that's often a really great solution to get rid of things and to get people to let go. But it really is, it's the memories attached to the stuff usually, and not really the stuff. So we talked through a lot of folks, with that, but it depends on the person. It depends on the kind of family support they have. A lot of times you need counseling after if you're a hoarder, and there's often trauma surrounding the reasons that you hoard. So there's a lot behind why people collect too much stuff and why people can't let go of it. So, but just know that it doesn't mean they're crazy. It doesn't mean they're lazy. It doesn't mean they're bad people. It's just their way of coping with something. Yeah.
And she grew up kind of poor, and certainly my dad didn't make a lot of money. So, you just don't throw things away.
That generation.
And I think that was a lot.
Right.
Yeah. They didn't throw things away. They earned their money. They paid in cash. That was the big family dining room table with the china cabinet and all of the dishes and the flatware and the crystal and the memories surrounding all that. That really said, you'd made it. You've made memories with that stuff, and it's just so painful to know that nobody really wants that.
Right.
Right. Yeah. After she passed away, I was responsible for cleaning out her house, and it was it was not painful to get rid of the stuff. It was just painful to have all that work to do. And there was no hidden money or gold bars anywhere.
Sometimes we find some pretty cool stuff. I will say we found lots of cash in books.
Coffee cans?
Coffee cans, cigar boxes. One of the things, and I worked with the guy on the show Hoarders, so he found a lot of really interesting stuff. But one of my favorites was a cigar box, because that generation did save and always and knew what it was like to not have a lot. So there was a cigar box labeled string too short to use. And sure enough, in that box was a bunch of string that was really too short to do anything with. But just in case down the road you needed those. But that was also
an
the
emergency
generation
string need. Yeah.
Yes. That was the generation that fixed things though, right? It wasn't the throwaway generation. It was like you tore the nails out, flattened them out, reused them. So that, that's a different, there's kind of generational reasons for hoarding too.
Mm-hmm.
I think I just saw a meme where a dad is helping his son. The bed is not level, and the son's like, I need a piece of wood like this tall. And the dad just like jumps up, like runs to the basement and finds this piece of wood that he's been saving. He's like, it's perfect. And he comes up and puts it on and it's perfect. And it does remind you of your parents. I mean, I'm that way. I have a toolbox with all kinds of, I save every extra screw they give me for anything that I buy and put it in there because you just never know.
You do not ever know
when you're going to need that for something. So that's really funny.
So anyway,
and that's the real world.
I think we should do a whole show
We
on
should.
maybe downsizing,
We should.
hoarding. I have lots of resources for that, but it's been great. That kind of background has also helped me really, just understand, hey, everyone's going through something, right? I mean, we see that all the time in little memes, but people really are. I don't know anyone who's not going through something.
Yeah.
And so, and this has just led me now to one of the most, rewarding programs I've ever been associated with, is this. And just so many millions of Americans are living with dementia, and it's affecting their family members. It's affecting their finances. It's, it's emotional, but it's not sad. Like people sometimes look at me and go, what a depressing job. Yeah. And I'm like, this is one of the most joyful jobs I've ever had in my life. So, because there's more to people than dementia, right?
Right.
So
I brought up coffee can because I've delivered as a kid at a pharmacy when I was in high school, and people would bring you into their house, take you into the basement, pull up coffee can off the shelf. There'd be coffee in it, and they would dig in and pull out like a roll of 20s, and they would pay you cash for their prescription. And you have to understand the things about those different generations, and it's different now. I'm sure now a delivery driver is never invited into your home. Certainly isn't going to go to your basement, even if you ask them to go to your basement. Like all of those things, but it's a different generation, and we have to be cognizant of who they are and what they went through not as a people, but also as individuals to figure out how do we apply the right things to them from a healthcare perspective. And I think that's one thing our pharmacists will be very interested in is we're going to start taking care of people now that live at home. What does that look like? What am I going to be faced with? Sure, I'm going to be faced with the classic, fairly independent person that, can call them up and say, I need a refill or I want my meds in a certain packaging. But then we're going to have the spouse that has somebody that's demented as their spouse and have all different kinds of needs and be dealing with all other different kinds of things that will make the need to tailor their healthcare to them, patient specific, person specific, and we have to be ready for that. It's a different environment.
Yeah, and we're kind of a gateway into all of that. I think again, non-clinical. We don't even call it a dementia friendly training. It's a dementia friendly session because I don't want anyone to get the wrong impression that this is a certification or anything like that. Right. This is really like, hey, anyone can take this. We adapt it for, there's a lot of adaptations out there, which are really interesting. For example, one is for people in incarcerated settings. So we have an aging population also in incarcerated settings. Well, we need to address that and the folks working in those settings. So there's sessions for incarcerated settings. There's elementary school, kids who might be living with a grandparent to just raise their awareness. Maybe they can recognize some signs, symptoms, understand how to talk with grandma or grandpa. And so it's really been interesting. There's a lot more information on our website, but the amount of cross-sector sessions that are sector specific are really, really amazing and growing.
Yeah, I mean, we used to always educate everybody in the nursing home, from the cafeteria staff to the CNAs to the clinical staff, because you didn't know who had a relationship with somebody and what they could bring to that not the relationship itself, but to the healthcare of that person. Like maybe the cafeteria worker is the one that says, their face is drooping today. And maybe they're the one that recognizes somebody having a stroke or whatever it is. But you had to do that broad education. So it's interesting. That's awesome that you guys do that.
Yeah.
You mentioned a dementia-friendly business. Is that specifically helping a regular retail business understand how to deal with those population, or is this something else?
Yeah, it's just, we can offer some the regular just become a dementia friend, session to folks who are working in a bank. But we have some sector guides that we're developing that are more specific to, we work with the businesses to kind of say, what do you run into? What do you see? What do you do? Let's make sure that we include anything that would be useful to your specific business, that we could add to this Dementia Friends program. So, everyone wants to go get a haircut, people like to get their hair done. So having a hairstylist that just understands
100%.
some ways to ask a question that, the processing of the brain when you have dementia is just different. And so to ask questions in a way that doesn't tax that processing as much, fewer choices, maybe 7 words or less, just really easy to understand ways of asking a question that can be really helpful.
Absolutely. So, from our perspective, we obviously see a lot of alignment. We have a relationship already from our past work. Where do you see people struggling with medications, either as people that have dementia or, like I mentioned before, spouses or loved ones that are taking care of somebody with dementia? And how can our pharmacies and pharmacists engage?
I think both. I think, it's people living with dementia and their caregivers. It's going to just be it depends on where you are, in your journey. It depends on what your capacity was beforehand and how that is changing. So, I think, consultant pharmacists especially are going to run into this probably more than I would imagine your front facing kind of, everyone thinks of CVS and Walgreens when you hear pharmacist.
Sure.
I didn't know what y'all did until I worked with you. And I would imagine consultant pharmacists are going to just run into this a lot more than we are. So, and honestly, just as a consultant pharmacist, once you're part of our dementia friendly network and we develop things together, that's an opportunity for consultant pharmacists to let everyone in their network know about what we're doing.
Absolutely.
So, y'all are going to touch so many people.
Yeah, I think when we were talking about the cafes, I think that is just a natural, it almost sounds like a church brown bag event from a pharmacist perspective is, how can we get the pharmacist to those cafes to just talk about, hey, we're trying to be age friendly. We're trying to help people age in place and stay at home. Here's what we offer service wise. And that may appeal to a lot of those individuals that are struggling with that component of medication use, again, for themselves or for their loved one. They want to stay at home. And pharmacists will have these wild solutions like pouch packaging and all kinds of things, but it's not limited to that. It's a whole approach that says, yeah, we know what you're going through. We can answer the questions that you have. We can get you to the right medications, which might be completely different from this person as it is from this person, but it's the thing that allows them to manage at home and not be in a position where they feel like, well, I have to get a home care nurse, or I have to go to an assisted living facility, or I might have to go to a nursing home, because we know no one desires that. So anything that we can do on the front end to help them manage better, knowing that they get very few resources, that even if they're even if they're a dementia friend, they've taken a step that most people probably already haven't taken yet. But how do we help them? So
there's so many opportunities to work together on something like that. My brain's already just turning and turning. So we'll have to maybe do this again and after we develop whatever we're going to develop.
Well, I know our membership will be very intrigued and interested in that. And like I said, when you think of traditional consultant pharmacist, you're assigned nursing homes. You go in, you're doing all this very important work for the people in the nursing home. But it's the assisted living that's more of a, how do I get involved there? And then in the community, it's even more of a, how do I get involved there? How do I find people that I know I can help, that need my services. And fortunately, the healthcare system is sort of circulating around ways that your health benefits are, you can pay for that.
Mm-hmm.
You don't have to pay out of pocket. It's not a cash thing in every instance. So there are ways that we can marry up pharmacists and some of these individuals and the caregivers and really provide some good services. And it's just about putting in the same room together, or sitting at the same cafe.
Sitting at the same cafe. Or, well, we actually have an event coming up. I don't even know if I mentioned this yet, but it's free. It's online, but it's called Dementia Friendsgiving.
Okay.
So,
oh, wow.
Yeah.
I love that.
So we have Teepa Snow. She's our keynote. And then some folks doing a little bit about each sector, you know, the Dementia Friends, the communities, and the Memory Cafe Alliance that we're partnered with. There's also some dementia-friendly choirs out there. So we're going to do a little bit with them. It's called Giving Voice, because music is such an amazing way that the brain the brain just processes in a different way with music. And people, you know, we've heard stories of folks who've been nonverbal for years, but you hear a song and it just, the words just come out. So it's been amazing to kind of work in that space too, and see that. And just, again, as a layperson, I mean, I have an English degree, so I don't pretend to be a healthcare, all the benefits. I'm going to have to probably come to you one day and go, I don't know what, I don't know what's going to get paid for you. And, but from that kind of just, very layperson, you just see so much magic in what we do in so many ways that, and people can really live well with dementia. It's pretty amazing.
That's awesome. When is that?
Oh, it's, I do know, actually. You can go to dfamerica.org, Dementia Friendly America. So it's dfamerica.org, and it's called Friendsgiving, and it's on November 18th. Okay. 11 a.m. to 3 p.m. Eastern. And then there's a little after party from 3 to 4 where you can just kind of hang out and get more information in a very casual setting. Yeah,
let's figure out how to make sure our members are aware of that and work together on that. That sounds awesome. And our producer Connor is a singer, a cappella singer. So
really, Connor?
I think he perked up when he started talking about that.
Okay. Well, this is definitely not our last conversation. So.
Right.
I was going to say, the time is right. I really appreciate how ASCP concentrated on the age-friendly pharmacist of this year, and whether they're consultant pharmacist background or not, but a lot of pharmacists said, man, I associate with that. I want to become an age-friendly pharmacist, and this just ties right in. But there's never been more important time in America than to concentrate on being age-friendly and dementia, because of the number of seniors we have coming to America, and it's going to be a tidal wave. And we've got to have the proper education and understanding of these people are human and they need help, and they might not be able to interact and relate to like they normally did. But if we don't know how to walk with them and talk with them, then they certainly are going to, not be better off if we can't handle that. So.
Yeah, exactly. It's all about just kind of and reducing that stigma of I don't know how to deal with this, so I'm just not going to deal with this, or I don't feel empowered. But yeah, it's a perfect time. And I had seen Chad put on his LinkedIn, the age-friendly consultant pharmacist, and that's when I was like, I need to reach out to Chad. That's a perfect kind of tag on. And we've gone to the age-friendly ecosystem, summits, because it's very, we're very aligned with what they're doing, just in a little bit different way. And we get like people ask me sometimes, how are you different from the Alzheimer's Association, which is also one of our supporters. We love them. They're focused on the cure and research and all of those wonderful things. And we absolutely want that. I would say Dementia Friendly America is it's right now. You have dementia right now, or you're living with someone with dementia. And so we're your right now organization of what can we do for you to help you live, thrive, do well.
Absolutely. I mean, when we look at the age-friendly structure with the 4 pillars of what matters, mentation, mobility, and medications, what matters is that piece that is this sort of, extend out and talk to the family member or the patient and ask them what is important to how you're engaging healthcare. And I feel like that's the piece that I can say that, yeah, I've practiced in older adult medicine for 25 plus years, but it's only recently that we've really focused on that patient engagement and talking to them. And, instead of saying, oh, you have high cholesterol, you have to take this drug. Now it's, oh, you have high cholesterol. Okay, what are your goals here? Like, what do you, how do you want to take your meds? Do you want to take something that's 4 times a day? Do you want an injection? Do you want something once a day? How aggressive do you want? Like, all of those questions are more recent healthcare things than in the past. And I think that's all part of this, is getting a better feel for who the person is, and then applying some of that knowledge that we have as pharmacists to, what might work for them,
right,
and fit into their lifestyle and elevate them.
Mm-hmm.
So.
Yeah, it's that person-centered focus, right?
It seems simple, but our healthcare system works really hard to make it difficult.
Well, luckily, I don't work in health systems too much, so I'm going to leave that to you. Unfortunately for you, I suppose.
Yes,
but it really is. I love that whole kind of switching your mindset. It's a person with dementia.
Right.
It's not a dementia patient.
Right.
All of that, right? A person with cancer. It's still it's this person.
Yep, that's awesome. Well, Tom, any last words?
No, it's exciting stuff, and I appreciate the partnership here. And if we are going to have Jennifer get up and speak, I think we should call it Hammer Time, and that would bring everybody together.
I've worked for a long time and hadn't thought of that.
Yeah, I get called that a lot. I get called Hammer Time a lot, and I get called Tex a lot because I grew up in Texas. So,
nice.
Yeah, I get them both.
So we'll have Hammer Time. We'll do dementia-friendly Hammer Time. I love it. It's great.
Those things probably don't make sense blending together, but we'll make it work.
We'll make it work.
I love it.
All right. Well, thank you for being here. Appreciate
it.
Appreciate the partnership, and look forward to what we can do together as organizations.
Likewise. I'm excited. Nice to meet you, Tom.
All right, everybody. We'll see you next time on RxPerience.